Hey listeners, you're invited to the club. Fighter Club, that is. If you're looking for a way to become a more active part of this movement, consider joining Fighter Club. For as little as $10 a month, you can create a real impact by supporting our efforts to educate and raise awareness on the harms of porn. Plus, by joining, you can get insider info, 30% off all Fight the New Drugs conversation starting gear, access to our secret store, and an exclusive Fighter Club kit sent to you when you sign up. Join Fighter Club today at ftnd.org/FC. That's ftnd.org/FC. See you in the club.
My name is Garrett Jonsson, and you're listening to Consider Before Consuming, a podcast by Fight the New Drug. And in case you're new here, Fight the New Drug is a non-religious and non-legislative organization that exists to provide individuals the opportunity to make an informed decision regarding pornography by raising awareness on its harmful effects using only science, facts, and personal accounts. We want these conversations to be educational, uplifting, and hopeful. As we sit down with experts, influencers, activists, and people with personal accounts, we cover a wide variety of topics that may be triggering to some. You can refer to the episode notes for a specific trigger warning. Listener discretion is advised. Today's episode is with Dr. Debbie Akerman. During the conversation, we discuss what classifies porn addiction, what caregivers can do to be part of the solution, and the hope that is in the recovery process. With that being said, let's jump into the conversation. We hope you enjoy this episode of Consider Before Consuming. Well, Dr. Akerman, we appreciate you being with us today. Welcome to the podcast, first of all.
Thank you.
We always feel fortunate and grateful for the opportunity to speak with someone like yourself. The name gives it away. You're an academic. And it just hit me, Dr. Akerman, that you have a doctorate. Like, that's a big deal.
Thank you. I think so.
How long did you go to school to earn that title?
A long time. So I started my master's in 2008, and I graduated in 2010. And I was invited into the PhD program in my last semester. So I graduated the end of July in 2010, and then I jumped into the PhD, and I started in August of 2010, and I graduated in 2019. So this was a 9-year process, which included 3 more years of school. It's an additional 60 doctoral credits, and then you start to write the dissertation. My dissertation is also on addiction. I focused on addiction in the Orthodox Jewish community. I'm Orthodox Jewish, and I wanted to talk about addiction in the Orthodox Jewish community, which is building momentum, but when I was writing my dissertation, it was still kind of at its infancy. And then you write and you write and you write and you write and you hand it into your advisor, and they slash it with a red pen and say, try again. And
wow.
You go have some chocolate cake and you try again. So yeah, I graduated in 2019 with my dissertation.
Wow. That's impressive.
Yeah.
That's an endurance event.
It is an endurance.
Right.
It's a marathon. You sign up for a marathon.
Yeah. So your children, all of your children, by the way, do you mind if we mention that you have 11 children on there? Okay.
Very, very proud of my family. Definitely very proud of the family I have.
You didn't have children during your studies to earn a doctorate, if I'm doing the math correctly.
No, I didn't. Actually, when this is why this is so providential, and I'm really so honored to really be with you, Mr. Garrett, Dr. Garrett, giving you a doctorate, Dr. Garrett. My entire foray into the helping field and into social work was that I had been living with somebody who had active addiction, and I had no idea. All those songs and poems and stories about the wife is the less to know are actually quite correct. And the bottom, we really hit a very bad bottom. And so I had to go to school. The effects of the addiction were really bad financially, legally, and there was kind of no choice. So when my baby was 1, I started graduate school, and I finished when 1 years later.
Goodness.
Yeah.
Well, we are grateful that you put in the work day in and day out for all of those years and continue to do so, because we are, we're reaping some of the fruit from your labor. So we appreciate that.
Well, I remember when we met on the radio show, and I was very impressed that you were bringing sex addiction out into the forefront of communities, because I think addiction in general is still so stigmatized and so misunderstood. And sex addiction, for sure, is probably one of the most misunderstood of the addictions. And if addiction itself is moralized, sex addiction is just moralized on steroids. People just cannot stop stigmatizing and moralizing it. So I think this is great, and I'm really happy to be here and to work with you.
Great. Well, again, we're grateful for the opportunity to speak with you. And as we jump into the conversation, one of the first things that I want to talk about is the fact that you are a therapist. And one of the qualifications, and tell me if I'm wrong, but one of the very important things when it comes to being a therapist is unconditional positive regard. You got to hold that for your patients. And I just wanted to ask if that is something that comes easy to you, or is that something that you've had to learn?
So I very much, because of my own personal experience, I very much believe in the concept of the wounded healer. Are you familiar with that?
The wounded healer.
Yeah. The wounded healer is a concept from Carl Jung. Carl Jung was supposed to be Freud's successor. And he and Freud kind of broke over a philosophy, but Carl Jung kind of put down this concept of the wounded healer. It was one of his archetypes, one of his personality types.
Okay.
And what he posited is that a doctor, really, he was talking about a doctor, but it's used for therapeutic purposes also. When you go through that kind of same experience, or you have also had an experience of pain, then you become a much more effective clinician, whether it's a medical clinician or a psychological clinician. So, I have no problem sharing. My ex, that I'm no longer married to, had a really bad sex addiction that I had never had any idea. And it took me through my own journey of healing, and it took me through my own journey of addiction. And when I started to find out what that was and put myself into program and put myself into recovery, I very much understood that this is what I needed to do and wanted to do for the rest of my life. You do learn how to have positive regard, even though having gone through that experience, and you listen to people. But the more you listen to people and the more you really understand what addiction is, and this is really why I'm very passionate about it and love doing things like this, the more you can be able to explain to people the neurobiology of it, and that it is not a moral failing, and it is just a combination. It's the perfect combination between nature and nurture. The more I think that we're just able to work with it. Right. And to get to the end game, which we want to, which is for people to have understanding. They should just have understanding.
Right.
So, yeah, there was a little bit of a learning, but there was also, my own hard bottom. And I remember the judgment that I faced when this whole thing came out. And I don't want people to face that. It was painful. Yeah. It was extraordinarily painful. I myself come from a very insular religious community. And the fallout was bad. It was very bad socially. It was a disaster financially. There were legal implications. I mean, it was a bottom. It was definitely a rock bottom.
Yeah. I like that. The wounded healer. I'll have to look into that more. And it makes sense. It kind of aligns with the humanistic perspective of genuineness, acceptance, and empathy. And you can't really have empathy until you understand a person's point of view. And so that makes sense. The wounded healer makes sense.
Yeah, it's a great concept. I truly like it, and I really get into it, because when somebody sits with you, and I have my clients now that sit with me, and I see what they're going through, and their lives are in shambles, and their lives are not in shambles because they're bad people. Their lives are in shambles because they have a disease, and they have a disease that they can't talk about, and that they're trying to fix on their own, that just keeps spiraling out of control, and they get into trouble. And when you're able to therapeutically kind of say to them, like, okay, I'm here, and we can work this, and let's just work it out, the relief is so palpable. It really is akin to going to a specialist for some type of dreaded disease. You're sitting there like nervous, like, oh my God, what is it? What is it? And if the doctor can come in and say, like, you know what, we can do this. We can take care of this. You just want to cry. You literally just kind of want to say, like, oh my God, there's help.
Like tears of gratitude.
I face this every single day, whether I'm dealing with people with substance abuse or sex addiction or any other type of behavioral addiction. They're really desperate. And we need to keep talking about it. That is the only thing that we can do on a macro level, is to just keep pounding away at the educational component of it so that people understand what it is.
This is more of a personal question in regards to your personal account with your former partner. When you found out about his problematic porn consumption, or I guess I'm assuming that it was porn consumption. You just said some type of
no,
sexual
it wasn't.
addiction.
It was, it was both. It was porn. It was people. It was a mess.
Right. Okay. So with that addiction, looking back, was it challenging for you to have unconditional positive regard at that time towards
Yes.
him?
Yes. The bottom was so severe. The bottom was incredibly severe, and like many people that have addiction, it also manifested itself in a fair amount, more than a fair amount of emotional abuse throughout the marriage.
Right.
So the combination of really being emotionally battered for the better part of 2 decades and an extraordinary, and I mean, Garrett, when I tell you about a tough bottom, I mean, loss of career, legal ramifications, loss of status in the community. Did I mention the 11 children? Not knowing how we were going to pay food, mortgage. It was, a 1-year-old baby that I was nursing full time. It was bad.
Goodness.
It was really in a marriage
That's
that was
heavy.
in complete shambles. I mean, there was not one psychosocial aspect of it that wasn't hit. And I had no idea. I mean, can I make you laugh? I have morbid humor. First time I remember hearing the word sex addiction, I thought, and I didn't know anything. It wasn't in school. I thought, sex addiction? Okay, so you have sex all day. Is that a bad thing? Like, I kind of was thinking to myself, I'm like, so why is that bad? I mean, I understood that alcoholism was bad, and I understood that cocaine was bad and heroin was bad. I got that. But I remember thinking, like, sex addiction? Like, okay, so people have sex all day. Like, why is that a bad thing? Like, what are we talking about here?
Okay, yeah.
And I didn't understand it. I was just like, why is this not good? Like,
Wow.
if this is what he has, then why aren't we have the best marriage in the world? Like, what's going on?
Yeah.
I was very confused.
Huh.
But was it hard to have hard regard? It was. It was very difficult.
Well, I appreciate that honesty. And I think one of the benefits to that honesty, to your experience, is that, again, you can have empathy and relate to people who are going through these types of situations and say, hey, look, I also had this challenge of maintaining unconditional positive regard. So,
We tried valiantly to put the marriage back together. We definitely worked at it for at least 5-6 years afterwards to really put it together. But, again, we were talking about without getting too personal, there were other things on top of it that were not fixable at that moment. And it just wasn't going to go. Do I believe professionally and personally that people that have sex addiction can put their relationships back together? 1,000,000%. And I have personally worked with couples and have seen where they have just taken that marriage and stripped it down to zero, and they end up really, quite honestly, with some of the best relationships I've ever seen.
wow.
Totally.
I love that.
Where there's been, people that I know in my community that found out that they had a disease because their spouses had acted out in a way and transferred disease. We're talking about an insular, community where people generally don't have any premarital sex, and all of a sudden there's a sexually transmitted disease that happens. I mean, the bottom can be really funky. Yeah. And I have seen definitely more than 1, 2, 10, 12, 20, God knows how many couples that really dig in, do the work, and they save it.
Wow.
Not only do they save it, they really end up better. So
Wow.
I am a huge believer in recovery, and I really think my personal and my professional philosophy is that addiction is the only disease in the world that you actually get a choice. And to me, that is only empowering. You can go to any hospital across the country, and people would literally give anything to be told, you have a choice to get better.
Yeah.
And they don't. And here, it's like if you do the work and you work the steps and you go to program and you go to therapy, you can get better. You can manage it one day at a time. I look at that as hugely empowering. And that is really part of my therapeutic orientation, a big part.
Wow.
You can do this.
That's the first time I've heard it put that way, and I love that. That's inspiring.
Thank you. Well, I really believe it. I mean, you look at people with medical disease, and they want so badly to get better, and they'll do anything at that point, and they can't. And here it's just, you know what? It's going to be hard, and you may relapse, and that's okay. But you can get back on it, and you can actually do what you need to do. Stay honest, have gratitude, do service, have courage. And there's this entire support community that's there to help you, that's there to cheer you on, that's there to work with you. I find that only empowering. Only empowering.
Yeah. Well, as we as we prepared for this conversation, I had no idea that you had a personal account. And so I really appreciate you talking to that. And as we move forward, it's good to know that you do have that, the wounded healer is part of your journey. So that's really cool.
I mean, I'll share with you. I don't mind. And it's, I have a son that passed from brain cancer. And that really also very much shaped a huge amount of my professional philosophy. And I remember thinking at it then, it's like, you know what? He would do anything to get better. I would do anything to get him better. I would cut off my right arm. I would cut off both my arms and my limbs if he would just get better.
Yeah.
And he didn't. He passed away at 22. And I remember thinking about it then. It's like I did with all these people that have this disease. They can get better. We have to just allow for the process to take place and for them to do what they need to do, and they can get better.
Yeah.
And that's where it's kind of like it started to gel, that idea in my brain that, you know what? My son's not going to get better, but you can. You really can get better.
Yeah.
And I just find that to be like the most strength-based perspective that I can give anybody.
Wow. Goodness gracious. I'm all excited. Like, I'm all pumped up because, recovery is possible. And I think that for a lot of our listeners, and speaking from my personal account, like, we've all been to that low where we don't think it's possible.
Yeah. Correct. This is why this is so important. We have to just keep talking. Secrets keep you sick, and stigma keeps you sick. And the combination of secrets and stigma just keeps so many people mired in misery, and they don't have to be. They just don't. I actually heard this really interesting TED Talk that I was sharing with my class. I teach addiction at Wurzweiler. I'm on faculty there. And it's this young girl, and she was talking about, I was showing the class a TED Talk on the family members, on collateral information and the impact of the families, of addiction on families. And this young girl, and she said, she speaks very softly, and she kind of looks like Taylor Swift. She's real cute. She's young. She says, "Do you know what the real problem with recovery is?" And I'm waiting, I'm listening. She says, "It's still anonymous. It's still Alcoholics Anonymous. It's still Narcotics Anonymous." She says, "Why is it anonymous?" And I stopped the video at that point and said, I've often wondered the same thing. I recognize the need for anonymity. I respect the need for anonymity. Anonymity is the spirituality, and I will never, ever, ever, obviously professionally or personally, reveal anything. Mm-hmm. But why is it anonymous?
Yeah.
86 years later, right? What was Founders Day? June 10th, 1935?
Wow.
As we're going on 87 years, and we're still an anonymous program. And I get it. But wouldn't it be better if we were just kind of like, like let's say your neighbor is coming out the door and you're like, "Oh, Bill, how's your blood pressure? You doing good?" "Oh, yeah, I'm feeling good. You could go to your other neighbor, go, "Oh, Sam, how you doing? How's the addiction doing lately? It's okay?" "Yeah, it's okay. I'm doing good. I'm feeling good." We can't do that yet.
Wow.
Does that make sense to you?
Yes, it does make sense. Do you know what you should do, Dr. Ackerman?
Tell me.
You should go buy the following domain you should buy: alcoholicsidentified.com.
Okay.
I'm laughing because I'm kind of joking, but also part of me is kind of serious because it kind of aligns with what you're saying. There are benefits to anonymity, but at the same time, maybe there should be more of Well,
there are definitely benefits to anonymity, and I don't think people need to go around and talk about their blood work and, my sugar's this or my ketones are that. I mean, I definitely understand the need for privacy, and privacy is privacy. But there's just so much stigma and shame that's mired around it.
Yeah.
And it not only does it keep the person with the addiction, but it keeps the family members, and it keeps the kids, and it keeps everybody just really, in a way, just still running so scared.
It can be a barrier towards healthy conversation.
A huge barrier.
Yeah.
A huge barrier. I mean, I tell my classes when I teach that, back in, the 1600s, 1500s, 1600s, they used to take people with schizophrenia and burn them at the stake. They thought they were witches, right? Because they were hearing voices.
Yeah.
So they actually took these poor people that today, some Zyprexa, right, some Seroquel, right, some drugs can actually help them lead a meaningful life, and they killed them, right? So obviously, thank God, mental health has taken a huge leap. But I think that with the numbers that we see with addiction, with the numbers that we know are out there, I think we need to kind of look at ourselves and say, yes, privacy, every single human being is entitled to privacy. That is absolutely an inalienable right. But should we maybe just start to have more conversations so that the stigma continues to be lessened? It's just something to think about.
Yeah. I like that a lot.
Thank you.
As a person who has had unwanted porn consumption and I addressed it, my spouse, who I've been married to for 11 years, about 5 years ago or 6 years ago is when I kind of told her the truth about my, unwanted problematic porn consumption. And for a period of time, I wouldn't talk about it openly with other people. And she's the one who kind of encouraged me to do so in appropriate ways, because she was saying basically similar stuff that you're saying. It's like, if we want to change the conversation, then we should, and we want to remove the stigma, then part of that might be having open discussions in appropriate ways.
Yeah, I think so. I think that it's really a very interesting thing in Western culture, and I guess in the United States. And I love America, and I love living here, and I'm very grateful for everything that I have. I think we have this kind of like very weird dichotomy in this nation, and that we're a very sexualized nation. We really are. And we're becoming more and more sexualized, and kids are becoming more and more sexualized at younger ages. But to actually sit down and talk about it still makes many people really uncomfortable. And so this is kind of weird, right? So it's really out there. It's used to sell everything from orange juice to tires to, linen and plastic baggies. Everything is sexualized.
Yeah.
But nobody has a conversation. We don't want to talk to kids about it because we think that that's going to make them go out and have sex. But the literature is going to show you it's actually opposite. If you actually talk to kids about it, they actually will not. The literature shows you that the younger children that start sexual activity, the more depression they have. Because it's not for their worldview, but because it's so shrouded, again, in secrecy, right? And the best way to get a kid to do anything is to not tell them about it, or tell them they can't do it, or they can't talk about it, right? Mm-hmm. It's like the whole joke of the kid that goes to the ER and he has an eraser up his nose. And the doctor's like, oh, so why do you have an eraser up your nose? Like, because mommy said not to. Perfect.
Yeah.
Of course I'm going to put an eraser up my nose. Mommy said not to. So, of course, I'm going to literally take an eraser right now and stuff it up my nose. So we have this really very weird relationship with sex. And when we tell people, we say, you know what, we are born as sexual creatures. We are sexual creatures in the womb. It's a part of life. It is one of the drives to survive, like eating. And we have a very difficult time starting to talk about it. And just like eating can go awry. And parenthetically, Garrett, tell me if you agree with this. What is the number one also addiction that we judge so badly? Food addiction, right? And food addiction and sex addiction, they really kind of go hand in hand in a way, because it's not an external item that you're putting into your system that you become addicted to. It's a natural drive that goes awry. And we judge people who are overweight just as viciously. So I just think it's something that, we need to look at. But good for your wife. I think that's great.
So now you have me wondering what your opinion is regarding Maslow's hierarchy of needs in that bottom level. Some people say that sex should be included in the bottom level, and some people say it shouldn't be because it's not. For example, breathing. If we compare the need of breathing to sex, you will not live very long without breathing, but you will without sex. So do you want to talk to that a little bit, or would you rather just say skip? Next question.
No, I'm very fine with that. Social workers, the way we're trained, Maslow is definitely one of the models that we employ for everything that we do, because we are based in a theory called person and environment. And we definitely do work with a hierarchy of needs. It's how we study for our licensing exam, and it's how we assess clients, and it's how we base treatment plans. So I'm a huge Maslow fan.
Okay.
I think breathing comes obviously above anything, right? If, God forbid, somebody had their hands around your windpipe or around my windpipe, or we were in an ocean doing this interview and a huge wave was about to engulf us, we wouldn't be thinking about anything except breathing.
Yeah.
Right? And that's kind of what Maslow was saying. If you're in an ocean and I'm on the boat, and you're like, help, Debbie, please help. And I kind of look over the boat and I go, Garrett, do you want to talk to me about your sexual history? Like, what happened when you were 4, Garrett? Did you see your mom, like, without clothing? Garrett, how you doing? You're like, throw me a life jacket. I'm about to go under. So Garrett, who was your first girlfriend? Was that Kathy? Do you want to talk about Kathy? You'd look at me like I was crazy. You need a life jacket. You need to be hauled out of the water. You need to get on the boat.
Right.
Once a person is breathing, and Maslow actually put into that, you should know temperature, which is very interesting, because if you're too cold or you're too hot, right, that's also a basic human need to be temperate, to breathe and to be temperate. But I think it's kind of a trick question, and I'm glad you bring it up, because that's really unfair. We all need to breathe. We all need to breathe. But once we're breathing, once we are, God forbid, not intubated, right? Once we can actually breathe, well, then we are allowed to start to talk about other things that we need. And that's kind of saying like, well, you don't really need a hamburger. No, you really do. Do you need sex? It's a natural drive. Are there people who choose not to? That's a choice. Are there certain religions that choose not to? That's still a choice.
Mm-hmm.
But that doesn't mean that that is the choice that everybody is going to make. And it still doesn't mean that it is not a natural drive. There are also people that will choose to live on bread and water for their whole lives and to walk away from that pleasure or that stimulus in their lives. And the Bible talks about, the Jewish tradition, there's a concept of something called a Nazir. And he was a very holy person. And one of the things that he did was abstain from anything alcoholic. Never had wine, never had anything that had to do with alcohol. That was his choice based on his classification of religious observance. But that's not a global desire.
Right.
Not to mention that we need sex to procreate. We're not all going to be made in a petri dish. Thank God.
Did you say at one point during this conversation that we are sexual beings from the womb?
Yes.
Can you talk to that a little bit more?
You can look at ultrasounds. You can look at the literature. Babies will be found masturbating in the womb. And, I've had 11 kids. Talk to anybody. You have kids, Garrett, right?
Mm-hmm.
We're adults here. We can have an open conversation. You take off their diapers. Their hands will go straight for their genitals.
Right.
It feels good. See, but they don't have shame about it.
Right.
Right? It's like, this is good. This feels good.
It's just a comfort thing for them.
Well, like it is for everybody. Right? The penis, the vagina, there's a lot of nerve endings there. It feels good. And I work with a lot of parents who, their 3-year-old does it, their 2-year-old, their 4-year-old. The first thing the parents are like, no, don't do that. So we have this really wonderful, when you talk about basic Skinner and Pavlov, right? So, okay, my hand goes here and mommy now is like purple face, like, no, don't do that. That's going to be a little jarring, don't you think?
Yeah.
Like a little traumatic, right?
The conditioning starts.
Right there when you're 2 years old. Mommy's freaking out and daddy's turning purple and all of a sudden you're in your room like with the door locked and everybody's like, what just happened here?
Yeah.
Again, wouldn't it be better if we could just have a conversation and say, we know that feels good and that's okay. And this is what we call something that's private, right? And so you can take yourself to a private place, no problem. When you're done, probably want to wash your hands, right? Because it's a place that has bacteria and can be dirty. And then please come out and join us. Now we've normalized it. We've normalized it, right? So I was just working with the parents the other day who said their kid had this major trauma. Again, Orthodox child in a high school. He's caught in the stairwell with a girl, right? I said, well, did he rape her? No, they were just making out. School made a big fat hairy deal because it's an Orthodox school. I'm like, what do you think 2 15-year-olds are going to do? Where are we with this?
Yeah.
And so we put the shame. I'm preparing a talk for tomorrow night. I'm talking to a group of parents, and I read that somewhere in what we call the Talmud, which is the oral law of Judaism. It says there's a statement that says people would rather have physical pain than have shame. And when you talk to a lot of people, most people with addiction, there's such a huge shame history, such a huge shame and trauma history.
Yeah.
And I think if we normalize the discussion, well, then children would also be taught from a very early age what to recognize as healthy and then problematic, and would be able to report with much more ease and have normal conversations.
Right.
If that makes sense to you.
Yeah, that makes a lot of sense. You mentioned that our society is hypersexual, and
I think so.
Over-sexualized is maybe another way to say that. And I think that some of the listeners today are going to be caregivers of some sort, whether it's a parent or a different type of caregiver. And one of the challenges they face is having healthy discussions about whether it's about the harmful effects of pornography or about sexuality, generally speaking.
Yeah.
Can you talk to some of the tips you have for caregivers to talk about, let's stick to us as an organization because we educate on the harmful effects of pornography. How can caregivers have meaningful conversations with the kids that they care for in tactful ways?
Right. So I think, first of all, it's almost like the therapeutic process, right? When you go to social work school, I think you go to psychology school or LMHC or LMFT, whatever school it is, they spend a lot of time talking about you, about the practitioner, right? So I remember being in social work school and thinking like, why are they talking about me and my feelings? I want to talk about people's problems. I don't want to talk about me, right? So now I see the wisdom of it, because how we approach the problem very much is going to set the stage for how the client can respond to how we're approaching it. So if parents have an inherent discomfort talking about sex, they're either going to avoid it, they're going to make it shameful, or they're going to punish it when their kids bring it up or are interested. Does that make sense to you?
Yeah.
Right. So first, the parents have to be very clear on, where do you stand on this subject? What do you feel? Do you have religious rules that you want to employ? Do you have some morals and some values based on your own upbringing or your choices as an adult? And I think that it's just really important to start the conversation there. Once the parents are pretty clear about where they are, again, I think it starts at a young age. I think it is very important, for example, to give kids proper biologic names for their genitalia. Many cultures, many things have these kind of like code names or nicknames. And I think that it immediately makes it kind of like shame-based and secret, right?
Yeah.
You can call an arm, you can call a leg, you can call a head, but everybody has these kind of like very weird code names for genitalia. No, this is a penis and this is a vagina. So we start with like a normal conversation. Trust and relationships start from very young, right? When we have babies, it's an endless loop of feed and bathe and change and rock and walk, and that's called bonding. And that lays the foundation for being able to have different conversations. Your 2-year-old, your 3-year-old, your 4-year-old. Okay, you want to play with your penis, you want to touch your vagina, that's okay, but that's what we call privacy. Very important to teach children the difference between privacy and secrecy. That's a huge lesson that we have to start teaching kids, because secrets will keep you sick, and secrets are what will harm you. And when people want to take advantage of children, it's going to be a secret. So it's very important, and I tell my parents who are working with kids all the time, teach your children the difference between privacy and secrecy. Everyone's entitled to privacy. You want to go to the bathroom? That's a private thing. You want mommy or daddy to help you afterwards? No problem, but you're entitled to privacy.
Yeah.
A secret is something that can hurt you. So what I guess I'm trying to say, Garrett, is when you lay the foundation like that, when the child gets to be 8, 9, 10, 12, and I'm not unrealistic. I think a lot of the kids are going to find out about the birds and the bees and about sex from the street or from their friends. But I think it's very important for parents to lay the groundwork where it's like, I can come and ask you a question.
Yeah.
You will answer me. You will not yell at me. You will not shame me. You want to have a question about sex? Do you want to have a conversation? That's fine. Then we can start to delve into the more sub-themes. Sex is a language. It's something that feels good. It is something that people do between themselves because they like it. Many times it's an expression of tremendous like or of love. And it's something that we can connect with another human being, right? Because at the end of the day, sex is something that feels really good, but is in many cultures and in many places an expression of desire. Does that make sense?
Yeah.
If children want to ask about porn, I think then we can start to tell them about terms like objectification and about how people maybe are using this to make money. Maybe they want to, maybe they do not, maybe it doesn't feel good for them. And time to have that open discussion. And you start to just let the kids talk to you and ask their questions.
Yeah.
I think you're honest. Am I making sense to you?
Absolutely. One of the problems with mainstream internet pornography and its easy access is that kids to turn to pornography as a sex education tool.
Yes.
Rather than turning to a reliable source like you, the caregiver.
That's 100%. And I think that the other thing that I think is very important for people to understand, and one of the great dangers of internet pornography, is the brain, the addicted brain, the dopamine. Dopamine loves novelty. When you're talking about internet porn, and there's always a new person and a new image and a new body and a new combination and the brain literally goes into overdrive. And because it's so accessible today, and because any teenage kid can get hold of a phone for a month for very little money, right? Use it and then toss it or hotspot it, or you can really do what you need to do. It's imperative to have the conversation. And it's imperative, I think, really at that age to explain to children that, yes, there's a tremendous physical pleasure that goes with sex. You can use the words like huge dopamine hit. You can show them a picture of the brain like it goes here. You can explain to them what it means to be lovesick, right? Kids get it. Teenagers get it. We all get it. We all remember that first time we had a boyfriend or a girlfriend and you just walk around, you're dizzy, right? Nobody even told you what that was about. But you're you're a little lovesick. And I think that it's important to understand that you're not going to be able to have that conversation with your child at 14 if you didn't have a conversation with them at 4 or at 7.
Mm-hmm.
You can't just go from 0 to 100 and sit your son down and say, like, okay, I think it's time we have that talk. And your kid looks at you and you're like, I get it. We're done. And you're so relieved that you say, okay, good. I'm really glad. Let me know if there's I can do anything for you. I'm going to go mow the lawn now. And you jump up and you run out.
Mm-hmm.
It's a relationship and it's an
Oh, go ahead.
Yeah, no, it's an intimacy. And real intimacy takes real time. It's allowing kids to say things and to experiment and to tell you their thoughts, which could be 100% wrong or 100% off, and literally giving them the space. Okay, that's what you think. I hear you. Why do you think that? What does that do for you? Let me tell you that this is what I think is another approach and how we can treat people in another way and in a more respectful way. And it comes with that. That's one of the major problems with pornography, period. It is just the height of objectification. And that is when it becomes like the drug. But the drug then is another human being. It's not a vial and it's not a bottle. It's a human being that is literally being objectified to the nth degree for another person's usage.
Mm-hmm. You talked a little bit about dopamine and novelty being a driver for the dopamine.
Mm-hmm.
I'm wondering if you can talk to impulse control versus sensation seeking and a little bit more about brain development and why, again, it's important to talk about this with kids because of their brain development and that sensation seeking.
Okay.
I don't know if I'm verbalizing this question correctly.
Yeah, no, I think I understand what you're saying. So having kind of done hundreds and hundreds and hundreds of intakes on people with addiction, there's certain kind of majority of truths that kind of ring true. And that is that the majority of people who start their addictive journey, whether it was alcohol or weed or porn or anything like that, they generally start it when they're pretty young, 10, 12. And that's a developing brain. And what happens is that first zing, whether it's a drink or weed or porn, it kind of puts this imprint on the brain, right? The brain is like wet cement in a developing child.
Mm-hmm.
And so it's literally like, when there was wet cement outside of, your house when the guy finished and y'all looked for the truck to leave and then everybody just went and put their handprints on it because you knew he'd be really mad the next day, but hey, what's he going to do? It's done, right? And that's what it does to the child. The other thing that I also want to say, which we haven't really touched on, which I think is really important, is the role that trauma plays in addiction. And there is really, as you know, practically a one-to-one relationship between childhood trauma and addictive processes. So if you already have a child that has trauma, if you have a child that is looking to self-soothe, if you have a child that is feeling not part of things, is growing up in poverty, is growing up in a dysfunctional home, is growing up in a home of addiction where things are really very rough, this is going to be a very powerful soothe for a young developing brain. And then the brain is going to obviously want more and want more and want more. And so we have definitely now primed this brain that is growing to crave this sensation, to crave what it is. Now, when that leads to active addiction, which again, we never know how long that's going to take. It could take a year for somebody, it could take 6 months for someone else, it could take 2 years for someone else, it could take a decade for someone else, 5 years, no one knows. Now you're off to the races because now the obsession keeps going and keeps going. And the other thing that we really haven't spoken about, which is really important, is the macro influence on this entire process. It is so easy. It is so easy today to get access. We're not talking about the 70s in Detroit when I grew up where you actually had to go to the drugstore, go behind the wooden little thing and pick up a magazine and risk running into somebody that you know. All you need is a device and you're gone. Did that answer your question? I'm not
Yes,
sure
it
where we went
did.
with that.
Yeah, I liked that you talked to the brain development. That's what I was kind of referring to, the fact that they are developing even more so at the young age. So,
And you talk to people about it, and they'll tell you like they hit that zing, and it's heady. And again, if you can't talk to someone about it, if your parents will turn purple and start screaming, well, you're not going to go to them, right?
mm-hmm.
And then of course there's the sensationalizing of it, and then belonging to a group that does it. And this again feeds very much into the insecurity of teenagers. Also, I'll never forget. I was working in a public school one summer, and this is absolutely beautiful girl I was working with, and she was not doing well in school, and she had to go to summer school. Very, very bright girl, really bright. She was 14 years old, and she had already had a boyfriend. She was sexually active. And I remember her sitting in my office. She was crying. She just started sobbing. She's like, "I wish I had never done it." She's like, She's like, "I wasn't ready. I wasn't ready." And we kind of talked about it. I said, "So it's okay." And what were you thinking? She's like, "Everybody was just talking about it. Just do it. Just do it. Just do it." So I did it.
Mm-hmm.
It's like I didn't want that. It's like it was horrible. I didn't like it. I don't like him. And we really processed really throughout that summer that that's okay, and that it is her body and it's her choice always. And that even though there was just kind of, because her notion was, well, I've done it once, I may as well go out and do it again because that's what everybody's telling me to do. Not.
Going back to Maslow's hierarchy of needs, I think that it kind of goes into that third level, which is the belonging. Is that kind of
Yes.
what you're saying? Is that she felt like to belong, to feel like she
Yes.
belongs, she had to do
Correct.
this and that.
Correct. She had to continue to do this act, which she really she had a lot of insight, which is, I really don't want to be doing this. And teenagers, as we know, the thing they want most above anything else in the entire universe is to belong,
Yeah.
and to belong to a group. And
Acceptance.
again, if you're a teen that is growing up with trauma, you are going to so glom on to that friend group.
Mm-hmm.
And if that friend group is doing something that's going to pop your brain with a hit of dopamine, all the better.
Mm-hmm.
And so we have this actual perfect storm. We have a real perfect storm as to how to get it.
Yeah.
And it's there. I mean, I don't know about you, Garrett, but, you wanted to get porn where I grew up, where you grew up. You had to, kind of find your parents' hiding place and hunt for it and see what, and risk getting caught. Or, you were going to go to the store and pick this up at the local drugstore.
Right.
Your parents would have known in 2 minutes.
Right. Yeah, the Mayo Clinic, they list, if I'm remembering correctly, they list two risk factors for developing compulsive sexual behavior disorder, and the two risk factors are ease of access and privacy.
There you go.
So
Perfect.
That aligns.
Right.
And yeah, today we're dealing with the different thing when we're comparing the mainstream internet pornography of today versus what we grew up with. It's different.
Correct. Because again, even if you got hold of a magazine, you got hold of one magazine. So everybody gathered around one magazine. Yes, it was titillating. It gave you that high, the whole thing. It was one magazine.
Mm-hmm.
And dopamine likes novelty. So sure, you could keep looking at it, but it was one magazine. Now, any kid is off to the races.
Yep.
You just need a device. And you can get a device for very little money, a month at a time, if need be.
Yeah.
You don't even need internet access. Every kid on the planet knows how to hotspot it.
Yep.
They're very savvy.
Yeah.
We need to live in the reality. We are the most addicted nation on the planet. Alcohol and drugs and sex and gambling and food. This is our culture.
Yeah.
And so I cannot, accept the things you cannot change and change what you can. I am not going to change the macro level system. I can't.
Yeah.
But I can have conversation. That is something that I am able to do.
Yeah, I love that. That aligns with our mission statement, is to educate on the harmful effects of pornography so that people can make an educated decision.
Perfect.
I like that. Well,
Thank you.
You've talked a lot about addiction throughout this conversation. You've used that word several times. And that's one of the most common questions when it comes to the topic of pornography, is whether or not it can actually be addictive. And I get the impression that your opinion is that it definitely can be.
100%.
And first things first, I want to go back to something that you mentioned as you were talking about how long it can take to walk down that road toward addiction. You said it varies because we're all unique individuals with unique biology and unique experiences. But do you think it's safe to say that the majority of porn consumers are not addicted?
You know, that's a tough question. Because addiction is, and this is where people really don't understand it, it's really such a cagey, cunning animal. There are so many people that are quote unquote addicted, but they're also very high functioning.
Mm-hmm.
So it really depends on how are you measuring that addiction. Are they still showing up to work and making money? Yeah. Do they have lousy relationships? Okay, but nobody's talking about it. Do they have legal problems? No, they're keeping it at bay. So it's really like any other addiction. Other people that can drink a cup of wine once a week and they're fine? Yeah, no problem. Can they have a glass of wine every night and they're fine? Yeah, it doesn't mean that they're addicted. They have a glass of wine, they enjoy it, they move on with their business. Are there people who are functionally alcoholic or addicted that we don't know about? 1,000,000%. I don't think that we really have an accurate counting of how many people really have an issue.
Yeah.
Does that make sense to you?
Yeah. That does make sense.
Right? Is there everybody who views porn, are they addicted? Probably not. Are there vast numbers of people that are probably addicted to porn that we don't know about? Probably yes. And I think because it is the highest of the shame-based ones, that let's say the family members or the partners or the spouses, they're not going to talk about it because it's such an intimate thing.
Yeah.
So you're going to go to your girlfriend or your guy friend and be like, my partner's not really interested in me, like kind of on porn, because that really breeds to the codependency or the co-addictive thinking of what's wrong with me. I'll never remember that. I forget there was a story of I didn't work with this couple, but I went to a seminar and this woman spoke. This woman was like absolutely just luminously beautiful. Just one of these women you looked at, you're like, this is an incredibly beautiful, accomplished, wonderful woman. And this is the misnomer of kind of porn and sex addiction, right? Like I thought back when, I guess you have sex all day. Well, you don't. And her spouse wouldn't go near her. And she had no idea why. Drove her crazy, right? And we're talking about for months. He just literally would not go near her.
Mm-hmm.
So she said she went out one day, Garrett, ready for this? She went out one day and she bought a peignoir set that cost $2,000. It's a lot of money, right?
Mm-hmm.
She went home, she got her hair done, she got her makeup done, did the whole thing, lit the candles, threw the rose petals, put on this peignoir. $2,000. That's a lot of money for a peignoir set.
Yeah.
He came home, walks into the living room, candles, wife waiting there, roses. Hello, walks upstairs. She freaked out. She just could not even understand it.
Yeah.
So because she wasn't able to access the help. Now, it turns out he had a really powerful porn sex addiction. That's why he wasn't going anywhere near her.
Mm-hmm.
But she was so alone in this and so trying to figure it out by herself.
Yeah.
So I think there are, just like anything else, I think there are vast numbers of people out there that do have addiction, but they're just suffering in silence.
Yeah.
Because they're just too ashamed to even reach out and start this conversation.
That makes sense.
I'll tell you another thing, just interestingly, it's a little bit off the topic, but I think it is. My dissertation, I sent surveys to administrators of mental health clinics. And the one finding that really came back that struck me is that 75% of the people that responded said that their clinicians had no idea how to diagnose or treat addiction. I said, you know what, that one is really interesting because not everybody wants to treat addiction, and I get that. I love working with people with addiction and their family members, but not everybody wants to do it.
Mm-hmm.
But if you can't have the conversation, if you don't know what questions to ask in a clinical way, whether you're talking about a sex addiction or a chemical addiction,
Mm-hmm.
it's going to slip through the cracks.
Mm-hmm.
And I see couple after couple that come to me and they've done Gottman and they've done this and they've done that. And I believe in all of that, and it's all wonderful and it's all needed and it's all fantastic. But it's not going to help an addiction. And if you don't know what to look for and the questions to ask, you're going to miss it. And then you're going to wonder why it's not helping. Does that make sense to you?
Yeah. And speaking of diagnosing, I think that a layperson, let's say one of our listeners, they find out that someone in their life is consuming pornography. And let's say that this person is a child. And I think it's common for the adult, the caregiver, to jump to diagnosing them and say,
Right.
my kid must be addicted to pornography consumption. And I'm just wondering if you can talk to that a little bit and why it's important to leave the diagnosis to those who are qualified to give a diagnosis.
Yeah. So I think, first of all, we have to also separate when we talk about like children or teenage clients. diagnosing is often very difficult, right? So, for example, like show me a teenager that's not moody and overeating and sullen and, kind of like reactive. I mean, definitely not any of my 11. How about that? And I'm a good mom.
Yeah.
I think I'm a good mom. So it's a little difficult when we talk about like kind of that population, even in terms of sex. Show me a teenager that's not oversexed and, we'll start to have a conversation. But for sure, it's very important to leave the diagnosis for the professionals, because even a teenager that you think is oversexed and into porn, well, many of them are going to be oversexed and into porn. But when you apply that rubric of addiction, which we know, which is it interfering with other daily activities? Is it very high risk? Is there a legal involvement? Is there a health involvement? Is it being hidden? Right? Mm-hmm. Is there a lot of lying? Is there a lot of manipulation? What else is going on in the life of that child or teenager or adult? That's when you can start to make more of an effective diagnosis, right?
Yeah.
Because again, somebody who has a glass of wine every night does not necessarily mean an alcoholic. Somebody who has 2 DUIs and is not showing up to work because they're drinking and they're spending a lot of money and they're doing it in a high-risk situation, well, now we're talking about a little bit of a different issue. And somebody who's versed in addiction, clinicians that are versed in addiction, they'll lead the conversation so that the pertinent information comes out. And I think it is very important.
Thanks.
Also very important if you do find out that your teenage child, if your young adult is doing it, the way that you're going to approach it, you know how they say you have like one chance to make a first impression? You have pretty much like 5 or 10 minutes to kind of get that person on the right treatment path. And I think we have a very long history in this country of yelling at addiction and trying to punish it. And I think that we can all fairly much agree that that's failed. So addiction needs to be approached with understanding. It needs to be approached with treatment. It needs to be approached with compassion. It needs to be approached with probably you're not feeling very well. And there are things that we can do to make you feel better.
Yeah.
Generally, that's an approach that I have found that works much better than, oh my God, what are you doing? And what's wrong with you? And you're, not going to work so well.
Yeah. Can you talk to why porn can be difficult to quit? And when I ask that question, I'm more referring to the brain and what happens in the brain and those processes that can make it difficult to quit pornography consumption.
So I kind of look at that as why addiction, period, is difficult to quit, right? So the long and the short of it, and Garrett, if I'm saying something that's not correct, I love being wrong. That's always where you do the learning. Mm-hmm. So the brain has like billions and billions of synapses, these little spaces in between the channels. And that's where the messages get carried through. And there's 2 things that carry those messages. One is hormones, and the other one is something called neurotransmitters. Neurotransmitters are basically the dopamine, the endorphins, the GABA, right? This is what the brain makes to carry those messages, which allows us to do everything, to have this conversation, to do our computer, to talk, to drive, to cook, to do anything that we're going to do. So you cannot give the brain anything in substance or behavior that the brain does not already make. When you give the brain a substance or a behavior, and let's say it's a dopamine hit, an enormous amount of dopamine floods those synapses. Some of it gets absorbed, and then the rest will create the high. And the brain is a truly marvelous, clearly, one of the most marvelous organs that we have. But it becomes very lazy very quickly. And so it's going to really stop producing less of that chemical because it knows Garrett's going to give it to me, or I'm going to give it to the brain, right? And so it starts this real incessant knocking at you, which I think we know now as the craving. Mm-hmm. And then you start that vicious cycle. You give the brain the chemical, right? You start to build up a tolerance. You need more of it. The brain produces less. And you start this you go down that rabbit hole. Mm-hmm. When it comes to porn, if you have several hundred or thousand, whatever it is, porn sites, new ones being created, your brain is going to be on this incredible dopamine, literal overdrive. There's just not enough. Mm-hmm. And like any addiction, you just shut that off on the brain. Your brain doesn't know what to do with that. Not to mention that you have been using this to self-medicate and soothe. And so anything from burnt toast to a late tax bill to a fight with your spouse or your parents is going to throw you over the edge. You have stopped developing emotionally from the minute that addiction started. So you can't cope. You can't cope. Your drug's not even making you feel better. People don't talk about the compulsive masturbation that goes along with porn or sex addiction. People are hurting themselves. That has to be an addiction. It's falling under the same rubric as any addictive behavior. And so you're left with this brain that is battered. It's really battered. And you can't think your way out of a paper bag. I have had clients who have pretty severe porn addictions, and they will tell me, I am in a dark room by myself all day watching porn. I don't want it. I don't want to do it. I can't get out of it. It's a drug.
Wow.
It's like going into the cocaine, right? The crack houses. People would walk in there also and be like, you haven't eaten, you haven't shaved, you're shaking, you're a mess. Yeah. Because your brain is addled with that chemical. And I think when people understand that that is what is going on in the brain, it is an illness. So you asked me at the beginning of that sentence, like, do I think it's an addiction? 1,000%. 1,000%. It follows all the markers and all the trajectory of addiction.
What are some of the first signs that someone is addicted? Like, let's say someone's walking down that road, it's a gradual road, or let's say it can be a gradual road toward addiction. And as someone walks that, what are some of the first signs they're going to experience that are saying, yeah, it's probable that it is an addiction, or that it's walking towards an addiction?
Having difficulty in your relationships, missing important events, not being able to concentrate at work, spending a good part of your day at work in the bathroom on your phone doing porn at your desk, on your computer, locking the door, not locking the door, making that situation high risk that you have a threat of being caught, right? Spending more and more money, running up charges on your credit card bill for porn addiction, compulsively masturbating to the point where you're hurting yourself. I had a female client, who was going into the bathroom multiple times a day. She was hurting herself.
Yeah.
She was hurting. I mean, the first thing I was like, you need a gynecologist. You're in pain. She was injured.
Mm-hmm.
That's not normal sexual behavior.
Right.
That is an addiction.
Right.
So you follow the same rubric that we follow for any other addiction.
Yeah. Okay. You've talked about how the brain is one of the most amazing things. And we've talked about how the brain can be hijacked in a sense, and it can go towards an addiction, and it can eventually arrive at an addicted state. But I want to talk about the hopeful side as well. What is happening as someone walks down the road toward recovery?
Well, as you walk down the road to recovery, first of all, I think people get an enormous sense of relief when you actually can talk to people and say, you have a sex addiction, or you have alcoholism, or you have an opiate addiction.
Yeah.
Because now knowledge is power in this case, and okay, this is what it is.
Yeah.
When you walk down the road to recovery, you have to be able to take a very gentle but honest look at yourself. I'm a very big believer, obviously, in the person and environment and what happened to the person they didn't get to this place all of a sudden. So we definitely want to piece together what happened in your past and how we can make a plan for your future. One of the best things of recovery, of course, in my opinion, is to join the rooms and start to talk with other people. Because the 12-step rooms provide the safest, most non-judgmental place for people to grow up emotionally, for them to be honest, for them to start to look at how they think and how that thinking makes them act. Mm-hmm. Every class that I teach at the university, I give them extra credit if they go to an open 12-step meeting, to an open AA meeting. All my students come back. They all do it for the extra credit, obviously, no problem. But they all come back and they call it transformative.
Wow.
And they kind of say, like, you know what? There's just not a place like that in the world.
Yeah.
And really, quite frankly, I found two places in the world where there's no judgment. One is hospital waiting rooms, and two is the 12-step rooms. Because that's where you just get all the honesty and all the love.
Yeah.
Nothing else matters. We just need to be here for each other.
Yeah.
And so that's what recovery looks like. And I think when we start to talk to people about triggers, we start to talk to people about what is normal sexual behavior, what is compulsive sexual behavior, when we can look at people with understanding, and just like if they have a crack addiction and say, you probably don't feel so well. To look at somebody with a sex addiction and say, you probably don't feel so well. They've never heard that before, right? That just understanding of like, no, I really don't. You know that? Yeah. There's no way you can feel really well at this point.
Yeah.
It's a huge relief.
Yeah, absolutely. Do you think it's a safe comparison to compare neuroplasticity to a muscle? And when you exercise and feed that muscle in healthy ways and get enough rest and exercise that muscle in healthy ways and then rehab it if there's a small injury, is that kind of the same process that goes into rewiring your brain back to a healthy state?
Yeah. I believe that addiction, it's definitely an injury to the brain. And I think people are starting to understand that a chemical injury, right? Alcohol and crack and cocaine and meth and MDMA and opiates. But it's the same thing with a behavioral addiction. It injures the brain. It hardwires the circuitry. It hardwires the pleasure center. Addiction at the end of the day is a thinking disease. We want to know what people are doing. We want to know if they need medical intervention, medical detox, any type of medical help for the consequences. But it's a disease about thinking that leads to the behavior. And it takes time. The brain is the most marvelous organ, but it also heals very slowly. Addiction is a very quick run, and recovery is slow. And for sure, people have to understand the first 2 to 3 years is going to be a work in progress. I don't really like hearing that, but when you get that message across in that way of your brain is just going to need time to just rewire itself in the right way, I do think it's a brain injury.
Yeah. You said earlier on that people would prefer physical pain over shame.
Yeah.
And I'm wondering if shame could be classified as some type of pain within the brain, like a physical pain. Is that a stretch to say that?
No. I've had grown men in my office just weep, men that make far more money than I'm ever going to make. And they just start crying about, the time they wet their pants on the playground and everybody made fun of them, or they had the wrong lunchbox and they were made fun of, or their pants were too small, or, or girls that were bullied mercilessly because they had acne. Or shame is just, I think it is the most powerful of human emotion. And when we talk about children, I always tell my clients and my students, it's the one emotion you're not born with. You can see that newborn baby. They can be happy. They'll smile. They can be sad or bored, right? Even newborns get bored. Mm-hmm. They can be angry, right? Mm-hmm. Take their diaper off, take their bottle away, stop nursing them. They'll howl. And they have pain, right? Every parent recognizes that shriek of pain that a newborn can, or a baby can do. But they're not born with shame. We teach shame. We teach it. And most notably, we start to teach it around that 2 or 3 year old area, where they do things like pull off their diaper and play with their poop or start masturbating. Oh my God! We have now just taught a kid what shame is.
Wow.
Right? So it's really such a powerful thing. We teach shame. It is a taught emotion.
Yeah.
And I got to be honest with you, Garrett, we're really good at it.
Well, Dr. Akerman,
this was great.
It's been a pleasure. You've been really fun to talk to. You are very engaging, very smart. I love your perspective on things. Thank you so much for sharing it with us.
I'm inviting myself back. I'd love to talk to you again at any point on, we can keep getting the message out.
We would love that.
My pleasure. I so admire your mission statement and what you're doing. And really, this is an honor, and I'm very grateful. And I would love to be able to come back and speak to your audience again.
We would love that. And we'll take you up on the offer.
Thank you, Garrett.
Before we finish, Dr. Akerman, I want to leave you with the opportunity to have the last word during this conversation. Is there anything else that you'd like to mention or talk to?
I think we really covered a lot, and I think that people just have to understand that addiction is not in a vacuum. And as much as it's a micro-level problem, it's a huge macro-level problem. And I think that it really takes a village to raise a child, and it's going to take a village in order for us to start to change attitudes and policies and perspectives on this really bad disease. And it's a disease. And I really want to commend you for the efforts that you're doing, because it's through this, it's through programming, it's through talking, it's through reducing that shame and stigma that we're going to be able to change it. And we have to do this together. It has to be every level, micro, meso, and macro, to work together in order to affect change. So thank you so much for letting me be part of it. I appreciate it.
Yeah, absolutely. Thanks for joining us.
How can pornography impact you, your loved ones, and the world around you? Discover the answer for yourself in our free 3-part documentary series, Brain, Heart, World. In 3 30-minute episodes, this docuseries dives into how pornography impacts individuals, relationships, and society. With witty narration and colorful animation, this age-appropriate series shines a hopeful light on this heavy topic. In each episode, you'll hear from experts who share research on porn's harms, as well as true stories from people who have been impacted personally by pornography. Stream the full series for free, or purchase an affordable screening license at brainheartworld.org.
Thanks for joining us on this episode of Consider Before Consuming. Consider Before Consuming is brought to you by Fight the New Drug. Fight the New Drug is a non-religious and non-legislative organization that exists to provide individuals the opportunity to make an informed decision regarding pornography by raising awareness on its harmful effects using only science, facts, and personal accounts. If you want to learn more about today's guest and the conversation we had, you can check out the links included with this episode. Again, big thanks to you for listening to this conversation. As you go about your day, we invite you to increase your self-awareness, look both ways, check your blind spots, and consider before consuming.